Hi, my name is Dr. Rudramon, and through the Oral Health channel today we're going to be talking about traumatic dental injuries in children. Let's start. So today's episode is going to be very interesting for all parents who have kids, because of the fact that I'm going to be talking about traumatic dental injuries in children. Now, it is very common to know that because children are very active, they're mischievous and they're full of life and wonder, they end up hurting themselves in various manners, and sometimes they end up hurting their faces and their jaws and their teeth. Now, these injuries, which actually result due to trauma, known as traumatic dental injuries in children, usually they peak around for 1 to 3 years in girls and boys altogether, but it happens more in boys of the age of 10 to 12 years of age because of the fact that they indulge more in sports, in terms of contact sports, also athletics, as well as they are more mischievous compared to their girl counterparts. On top of that, they might also be indulging into fights which happen due to interpersonal violence. So traumatic injuries, basically they include why it is important for you as a parent or you as any person who knows a child or is taking care of a child, is that traumatic dental injuries can cause not only problems to the milk teeth that the child has, but also it can cause damage to the permanent succedinous tooth. That means that the permanent tooth bud that is growing inside the jaw of the child, which has not yet come out, that also can undergo a lot of changes because of the fact that the child went through traumatic dental injury. So the most common traumatic dental injuries are basically tooth fractures, which are basically crown fractures, which can be complicated or uncomplicated. Complicated crown fractures include pulp exposure and bleeding. At the same time, if there is any soft tissue laceration or something of that sort. An uncomplicated crown fracture is basically where there is no problem, there is just a fracture that has happened, there is no bleeding and there is no pulp exposure. However, in both the cases, the pain obviously is going to be caused because of the injury. You have to understand that the most common fractures are enamel and dentin fractures. There is a huge classification theoretically, but we will not get into that. The second class is basically avulsion. So what happens with most of the parents, or especially of children who have milk teeth, they don't really bother if their teeth have become broken or if they have had injuries or falls, because which has led to the loss of the tooth, which is known as avulsion. Now you have to understand that a permanent tooth bud has to come out on its own time, and if its predecessor, that is the milk tooth, has already left out, it can cause different sorts of problems. Secondly, if unfortunately the tooth has avulsed out, and you can wash it with basically warm water, or you can wash it with saline water and then try to replant it back into the tooth and then rush the child to the dental office. However, a lot of times you don't have that, the tooth is not getting reimplanted back. You can keep it in a medium such as the saliva of the tooth, bovine milk, or sometimes just water, that's all right, but the best thing to do would be put it in saliva. Now when it comes to other injuries, they include luxation. That means the tooth has gotten hurt but it's started moving in its socket freely, and there is subluxation where the movement is slightly less, compared to concussion where there is no mobility but there is bleeding and there is swelling and the patient is under a lot of pain. And you have other injuries as well, such as intrusive luxation and extrusive luxation. We will not get into the details. Needless to say, if your child has gone through some sort of trauma, and if the child does not have any other prodromal symptoms such as loss of consciousness, amnesia, or sort of blurry vision, or any sort of head injury, and the child is not vomiting or does not have any headache, that means these are general signs which need to be addressed first as a medical emergency. And if these signs are not there, then you can go and address the dental emergency. You can go to a pediatric dentist who can take care of these problems. You have to understand that kids will try to have fun. Kids do not understand the concept of being wary of the objects around them, especially the lower the smaller kids. Secondly, you have to be all these things depend upon the age of the child, the development of the tooth, the direction and the force magnitude with which the force hit the child, the tooth shape, the shape of the object, and by what time have you shown the child to the dental office. So this was today's episode. Please like, share, subscribe, and do press the bell icon button for important updates. If you want to get in touch with me, here are my social media handles. Kindly refrain from calling directly, as I might be busy with patients. If you want to really get in touch with me, drop me a message with your name, your place, that is your location, and what is your common oral problem that is giving you some sort of discomfort or pain or any sort of dissatisfaction. You drop me a message and I'll get back to you within a couple of days. If you have any queries, doubts, apprehensions, insights, or suggestions, kindly please feel free to put them in the YouTube comment section. So that's it for today. Thank you.